Hello, everyone. Thank you for tuning in. Today I have Andrew So, physical therapy intern here at the Knee Joint in Corte Madera. I'm Dr. Neil Sartori, and today he is going to be presenting some information to you guys all about platelet rich plasma. Take it over, Andrew.
Thanks, Danielle. Hey, my name is Andrew. I'm a student from UOP, and I'm here for my rotation. Each rotation has us do an in-service at the end on a topic that we're interested in. We've had a couple of patients who've had this treatment, and I wanted to look more into it. So without further ado, here we go. So you may be asking, what is PRP? What is platelet rich plasma? So Total Sports Medicine from Las Vegas actually has a very good video that has detail on that. So let's watch that now.
PRP, or platelet-rich plasma, is a substance made from your own blood to trigger healing. Plasma therapy is a relatively simple, non-surgical treatment for joint injuries and arthritis. It merges cutting-edge technology with the body's natural ability to heal itself. The PRP is a concentration of platelets, which can jumpstart healing. Platelets contain packets of growth hormones and cytokines that tell the tissue to increase rebuilding of tissue to enhance healing. When PRP is injected into the damaged area, it stimulates a mild inflammatory response, which triggers the healing cascade. This leads to restored blood flow, new cell growth, and tissue regeneration. Because the blood is your own, there is not risk of infection or acquiring blood-borne diseases, such as HIV or hepatitis. A sample of blood will be taken from a vein in your arm under sterile conditions. Blood will be placed in a centrifuge, which is a device that spins the blood. This helps separate the blood cells from plasma and allows concentrations of the platelets. This process increases the concentration of platelets, which have the healing growth factors from the normal 6% to 94%. The preparation takes about 15 minutes. The finished PRP product is then available for injection into the joint or tendon under ultrasonic guidance. Patients can see a significant improvement in symptoms, as well as a remarkable return of function. This may eliminate the need for more aggressive treatments such as long-term medication or surgery.
All right. So let's say you actually receive a procedure where you have PRP injection. As a relatively new treatment, there's not concrete protocols on how to maximize the effect yet. There's general guidelines showing that a common theme of immediate rest is recommended. This is to allow time for inflammation, or the body's natural process of healing, to occur. That can range from 10 minutes in some studies to 2 days of rest. Following rest, there's a recommended light movement and light activity. There's often debate among physicians about the use of ice, because ice is commonly used to reduce inflammation and allow pain relief. Consensus has been made, however, on avoiding NSAIDs, or non-steroidal anti-inflammatory drugs. Remember that PRP is basically a high concentration of the body's own building blocks to repair itself, so it still needs to allow time for healing. So let's talk about who can best benefit. There's a wide range of ages in the research. The emphasis is not so much on age as it is the condition of the body. There's studies that have shown that mild to moderate degenerative conditions respond better compared to severe degenerative conditions. It also shows that males tend to respond better to this procedure as well. It's to be noted that the procedure is actually not covered by all insurances and can range from $500 to $2,000. So let's talk about symptom improvements. The research shows that acute tendon and ligament injuries that showed minimally significant improvements in pain and no significant improvements in function. The research had patients who underwent Achilles tendonitis, had hamstring strains, plantar fasciitis, and patella tendinopathy. On the other hand, it showed that knee osteoarthritis patients showed improvements in pain, mobility, and function with very small risk of adverse events. These osteoarthritis patients had similar results from PRP as hyaluronic acid injections. In terms of duration of the effect, it actually takes time for the body to rebuild itself. One research showed actually no changes in pain levels or function until 3 months had passed. The general consensus is that improvements in pain and function occur between 6 months and 24 months. Repeated injections of PRP benefit mild to moderate degenerative conditions, while severe conditions of degeneration or arthritis respond the same to both single and multiple injections. There's been a consensus from local physicians in the Marin area that positive results are being seen with consecutive injections. As a summary, we see that there's degenerative conditions benefiting more from PRP as opposed to acute tendon or ligament injuries. Pain relief and function improvements take a delayed rough 6 months to occur and last up to around 24 months. And within the arthritic population, there's multiple injections that help when it comes to lower level degeneration, while single injections work better for severe conditions. I've included here a list of areas for further research. Many of the studies only show a time period following patients for up to 2 years. So beyond 2 years, there isn't much understanding on how the patient's condition will benefit. Post-injection protocols are still not set. There's debate, as mentioned before, on cold therapy or ice, because many patients will still want to use the ice for pain relief. Other researchers have debated whether or not limiting physical activity is beneficial or not. Surgical procedures have been put in place for a person to set them up for success, but we are not yet sure on what are the limits and what is encouraged in terms of physical activity. And the last point I want to highlight is the benefits of PRP with or without physical therapy have not yet been studied. We know that having a healed injury does not necessarily mean we're able to do all that we want to yet. Strength, coordination, flexibility, and load tolerance are all part of what physical therapy provides to get people back to their lives. PRP aims to improve physiological healing, while physical therapy enhances the body's capability and couples that with patient education to allow them to better understand the healing process. And it's worth investing time into the combination of those two. Here's a list of references that I used for this presentation, and thank you for your time.
Thank you, Andrew. If you have further questions, please feel free to reach out to us by commenting below. You can also reach us on our email address, which is thekneejoint415@gmail.com, or find us on Instagram or Facebook. Thanks for tuning in, everyone.